Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM OET Institute. Again, the only institute run by doctors having 10 years of experience, assuring you for the best of the best OET sample videos. Please subscribe our channel if you have not. And one important instruction, always listen to the videos till end. Because sometimes I do make things complicated for you, but at the same time, if you understand these fundamentals, this is going to make your life much easy. Like today I want to talk about this active and passive voices. So I really want that in the long run your journey should be easy, but for that your fundamentals should be strong. Means if we are trying to create a building and infrastructure, then pillars must be strong. So grammar is the pillar of English. So that is what our coaching being Dr. BKM is all about. That is grammar. So if you know grammars, you know basics. The last time we talked about degrees, good, better, best. So please listen to that lecture. I will attach that lecture at the end of this video, because that lecture is also about grammar. So I will connect the lectures so that you can learn about degrees. Today we are just going to talk for 5 minutes about active and passive voices. See guys, what is active? Active means anything done by me. So if I say I know you, that is active. Simple. I know you. I see you. If I have to say this thing in the past, I will say I saw you. I knew you. If I have to say this thing in the future, I will say I shall know you. I shall see you. Simple. This is English. Passive voices means if I do it otherwise, that you are known by me. You are known by me means that it is a passive voice. You are known by me. That means I have brought the object forward. This was my object. I know you. So you are known by me. Let's apply that in OET. Doctor advises the patient. So in OET or in any formal language, that what happens in the formal language, we do not talk about doctor. The Dr. James advised the patient. So in OET, what we say, the patient is advised by the doctor. Today, I'm going to teach in a different way so that you understand the application. So if I say, I know you, so you are seen by me. This is a passive voice. So now, second example, past. In this case, what will happen? You were seen by me. Same, nothing different. You were seen by me. And if I say this thing, you were known by me. No word again. I don't want to concentrate upon this word first because there is a rule of English, but I don't want to tell you this thing at the moment. But I'm just telling you the normal passive voices. I shall know you. You. Now this is what is the passive voice. Simple passive voice. You will be known by me. So please understand what are the different things. Or if I say I have seen you, these are the major passive voice used in OET. I have seen you, then you have been seen by me. That's it. See, I told you I will take 5 minutes and I will clarify all your doubts. Now, almost 2 minutes are over or 3 minutes are over. My active passive voices are also over. And now you will see how. So if you will notice, is MR third form? Is MR third form? Was were third form? Be plus third form. Been plus third form means if you will see all the four things are having be. If I use any model rather than shall, if I say I can see you, then the passive voice will be you can be seen by me. This is a passive voice, you can be seen by me. So if you will again see be plus third form, been plus third form, be plus third form, was were third form, is MR third form. So what is happening? So we can simply conclude that what are passive voices? Any sentence having be plus third form is a passive voice. Now you will say, sir, be plus third form, but in this sentence there is no be. then I will tell you that the first form of be is a verb. Be is a verb. The first form of be is am, are. This is the first form of be. So when is am, are comes with first form, with third form, it becomes a passive voice. Second form of be is was, were. In normal English, like I say, go, went, gone, do, did, done, see, saw, seen. In the same way, be is a verb. Is am, are is the first form of be. Was, were is the third form or second form of be. And been is the third form of be. So this is the rule of passive voice. That's it. You just need to know this much only. That if third form comes with any of this thing, be, is MR, was, were, or been, it is 100% a passive voice. Now, what is the difference between an active and passive? We have learned it. Doctor advises the patient. The patient is advised by the doctor. Like, why did we discuss this thing today? Because there was a blank. And if you understand this rule, this blank can become very easy for you. The blank was what can be avoided. And this will solve lot of reading part A and reading part B questions. What can be avoided by removing the antigen? Such a simple question, but it is not easy to understand. So now if you know the passive voice, this is the object. So if I have to make it active, I will say removing the antigen can avoid dash. So that is what OET does for you. That is what English does for you. That if you can understand that in the paragraph, this would be given this way, that removing the antigen can avoid this thing. So that's what exactly happened in this blank today. It was given removing the causative antigen such as this. These are the extra word. This is to confuse you, such as this. This is to confuse you. Removing the causative antigen, it is the example of antigen. Could, so can word was converted to could. Avoid word was converted to stop. So what could stop the progression of shock? Progression of shock becomes your answer. That was exactly the question in this reading. I'm just, again, my job is to teach you OET. I do not create question papers, thanks to institute who has created it. What can be avoided by removing the antigen from the body? That is where you are unable to find this. So first of all, focus on these words, removing the antigen. Go ahead, try to find this word, removing the antigen. Then as soon you see removing an antigen word together, this is the place where you need to find. Then you understand it must be given in the active voice to confuse you. Removing the antigen, could, that was can be avoided. Stop, can avoid the progression of shock. Progression of, you are allowed to write only three words. So you write progression of shock, or even you can write shock. Progression of shock is a better answer, obviously, because these are the three words. So then that is what active and passive does for you. Even in listening, even in reading, they will always play with you, even in the reading part way, with these kind of rules. Active and passives are very important. Let me apply these rules to writing as well. I will just, again, 5 minutes are over, my thing is also over. But when we talk about writing, writing is exactly the same thing. I am writing this letter regarding Mr. X. So in this sentence, what is happening is I is the subject, this letter is the object, is MR ing. I am writing this letter. That is where this happened. This letter is being written regarding Mr. X. So what you realize is that in OET, we do not want to write I, we do not want to write we do not want to write you. In OET writing, we don't use I, we, and you. That is why passive voices are so important, because you want to talk about patient, and patient is the object. Like I don't want to say in OET writing, doctor advised the patient regarding diabetic diet and medications. So what I normally do, I just take this thing, the patient was advised, that is where I make the passive voice. The patient, my rule of English, be plus third form, The patient was advised. Second form is because I'm using the past. Be second form, past, was were third form. So that is why I'm using this. I'm trying to use be plus third form, but in the past, be plus third form becomes was were third form. So the patient was advised. Now the rest of the sentence remain the same. Cut, paste. That is what means you don't have to see the complete sentence. You just need to know the grammar. Your focus should be on this part. Doctor advised the patient. This is all same regarding the diabetic diet and medications. I can cut from here, can post it here. I can cut from here and can again post it here. So the main thing is this sentence. Doctor advised the patient was advised. That is why we say the paracetamol was commenced. Paracetamol was commenced. That is what we do in writing. Why do we do it? Because doctor commenced paracetamol. So we change paracetamol was commenced. Then we say the patient was found with fracture. Why do we say this? Because it is the radiologist who found the fracture. Radiologist found the fracture. So what we are noticing as a difference in the active, there is no use of was. It is just second form. In passive, was were third form. So that is what is the thing. And that is why we write in OET letter that in the past visit, on first visit, the patient came with chief complaint of. What we want to say, it's an active thing. Patient came by himself. So we never say was came. We say patient came with the chief complaint of this and this thing. Then we say on examination, examination is done by us. Then we start using passive voices. On examination, the patient was found with this. The patient was commenced on this. That is what we use in OET, commenced on this. Then we say the patient was diagnosed with this, for which rest was advised. That is what is a perfect way of writing a paragraph in OET. That's it. Patient came with chief complaints of this. On examination, the patient was found with this, second form or third form. Then the patient was commenced on, means this all work is done by hospital. The patient was found by us. The patient was commenced on the medication by us. The patient was diagnosed with this by us. The rest was advised by us. That is what it is all about. To know about active and passive, your OET writing, reading and listening will also improve that. That is where we started from. Don't think that active and passive are not applicable on reading and listening. They make your life very, very easy. This is Dr. Bhupesh from Dr. BKM OET Institutes. Now I will attach that video which I was talking about. That video is basically of I forgot that thing, but I said in the start, I totally forgot that. Degrees. Degrees are also very important to do your reading questions. So that video is also very important. I will attach this video now. Please look out this video and don't miss out on this. These two videos can help you to pass OET reading and listening and can improve it phenomenally. Thank you very much. Thank you.